Well, hello.
Hello, everybody.
There's two of us again.
Alex is back. Yay!
Infant feeding. It's the infant feeding afternoon. It's our Facebook Live for you all. Looking forward to hearing all your wonderful questions. We're glad to be a duo again. It's so much more fun. So
we've been busy though.
Yeah.
So in the background. So
Yeah.
it's lovely to be back, and I hope you've got lots of questions. So this is the infant feeding team at the John Radcliffe in Oxford. We're on level 6 today.
Yeah, for a
which
change.
is the antenatal ward. So they're very full on level 5. They haven't got any spare space at the inn. So we've snuck upstairs an extra level. And so today's session is about infant feeding. So that's anything to do with infant feeding, whether you're pregnant or whether you're feeding your baby at the breast, or whether you're giving breast milk in a bottle, or if you're giving formula. If you've got any questions at all that you're not sure about, then please ask us the questions. We don't care how silly they are. We love questions.
I think as we often say, you might think it's silly or think you're asking a silly question, but invariably if you've thought it, someone else has thought it too. So
absolutely, somebody else will be thinking about it. So it does them a favour, and then they might be brave enough to ask another question. So that's brilliant that you were thinking about. So this is infant feeding only. We are midwives, but we don't work in all the departments, and so we can't always answer the questions. And in this climate that we're in, things are changing all the time. So the best place for you to direct the questions about anything other than infant feeding is to ask the midwife sessions, or to your own midwives, or to use the Trust website, which has got the most up-to-date information on it. So if you can't find the answer, then go to your midwives, or come to the questions and answer sessions with Ask the Midwives, and that's from various sessions across the week and also across the county. So you get to meet all the different groups of midwives in Oxfordshire.
Yeah, there was a lovely tour of Wallingford earlier this week. I saw that happening, so that was my colleague Corinne on that, and one of our other colleagues there. Just a quick hello to Imi and to Charlotte, who've both already said hello to both of us, which is nice to see. Our frequent visitors, it's so lovely. A thumbs up to tell us you can hear us would be really handy. I can see there's a number of faces come up on the top of my phone that tells me that you've all joined us. We're up to about 27, so just let us know you can hear us. That would be great. Anyway,
so this week we're sort of putting our brains together, and we have sort of meetings all over the place, and different groups of breastfeeding support. And so we had a meeting with sort of the county-wide group of supporters in breastfeeding, and so we talk about things that come up a lot. And I think one of the things that they see in the OBS and also out in the community is babies with early days breastfeeding issues, and babies not latching or attaching to the breast in the early days. So as soon as you've had your baby, sometimes they don't latch on for various reasons. They're very sleepy. You might have had a medicated birth where they're still tired like you are. And also, they don't know the skill, and you haven't got the skill, and sometimes it's very busy on the ward. So for various reasons, or you might want to rush home, and I think that we understand that. You want to get out of the hospital environment, particularly in this climate that we're in. You don't want to be exposed in the pandemic for any necessarily longer than you can. So people are rushing home, and often that means that their babies haven't had a lot of time to practice and have support with practicing to attach at the breast. So it's really, really important that you can get help appropriately, and also that you know what to do if your baby can't attach at the breast, and what the expectations are, because a lot of people say they get conflicting advice when they have their babies, and people come in and say a different thing to them, and they were told something on the first visit, and then the next time you get a visit, or you get a healthcare professional talking to you, they say something different. If that's 3 times in the morning and it's different advice, then that would be conflicting. But if it's something different every day, it means that your baby's needs have changed, and more often than not you get different advice every single day up to about 2 weeks, because your baby's doing lots and lots of different things over that time. So in the early days, in the first 24 hours after you've had your baby would be hopefully delivered skin to skin with you, and you have an opportunity at some point in that first hour of having your baby, unless your baby needs to be separated or you're very poorly. I think we're very good at allowing you to, or enabling you, rather than enabling you to have your baby close onto your skin. And that's crucial in the first hour, the golden hour we talk about, in stimulating your prolactin levels, your hormone levels, which will stimulate you to make lots of milk. So the first one, and it will also prime your baby to crawl up to the breast and attach. And that first hour, your baby is normally really awake and primed to do it, and they follow the scent of their hands up to the nipple, which smells like their hands that have got amniotic fluid on them. So they smell their hands and they crawl towards the nipple, which also smells of amniotic fluid. The little blobs on your areola, the pink bit around your nipple, secretes a fluid which smells just like amniotic fluid. So the babies know to crawl towards that to feed. And they're very good at doing that if they're allowed to. So you need to have that uninterrupted time, and that's really important. That will allow your baby to attach and suckle at the breast, hopefully, and have a really good breastfeed. So if your baby's done that and you've had a good feed, just a short one, it doesn't have to be really long, but you know that your baby's attached and suckled, you can relax and know that they've set that priming up, your baby's had some calories, and everything's started the ball rolling. So if your baby hasn't managed to do that at birth for various reasons, then you need to be hand expressing. So you need to be stimulating your breast yourself in that first hour. So you need to be doing some hand expressing and getting some express colostrum, tiny little drops. You only need a little tiny bit. Remember that your baby's tummy is very small. It's size of a marble, tiny little marble.
There we go, absolutely minuscule.
And that's you don't have to fill it. It might be that little, but you don't have to fill it. It's just that's the size of your baby's tummy. So you don't have to give it a huge feed because it's not ready to receive that sort of volume. And so your baby might need 3 feeds in the first 24 hours. It may well have many more than that, but mostly they have 3+ feeds in the first 24 hours, and that might be with colostrum, or it might be suckling at the breast, express colostrum via a syringe. And so you can rest and snuggle with your baby, and if your baby's not showing cues, look at where it is. Is it in a cot with a blanket on in the corner of the room, away from you, or is it close to you, skin to skin, and smelling you? Because if your baby's tucked up and it's tired like you are, it will go to sleep and not show the cues that you're wanting it to do. So the rubbing its mouth with its hands, opening its mouth, sticking its tongue out, stirring. Last cue is crying, but your baby won't do those things if it's asleep and away from you. If you have your baby on your chest, skin to skin, it will start to prime and become a mammal and behave like a mammal and start to crawl to the breast and want to feed. So that you're going to give it more opportunity to do that if you keep it skin to skin with you and prime it to behave as it should.
We've got questions coming through, Naomi.
So I think that's the first day. We can talk about that, and your baby's rested. So we can talk a little bit more when we've answered a few questions, I think, and some of those questions may come up that we can answer again.
And I'm hoping that we are still beaming out there, because my laptop is telling me that they're having problems playing the video. So I'm hoping you can see us even if I can't see us on my laptop. So I think we're going to carry on and do questions in the hope that you can still see and hear us. Lucy's put up a message saying, "Hello ladies, my baby Mia is 5 weeks old. Approximately 3 weeks ago we had some pretty bad damage to my left nipple. It's at the base of the nipple at the join of the areola on the outside. Feeding's going great on the right side and we managed on the left, but it's still extremely painful. I bet it is, as the damage isn't healed, although it's better. I've tried a barrier cream, I've also tried Gelanet, it's better, and we don't think there's an ongoing latch problem. Is there anything you'd recommend to help healing? It's healing so slowly, secondary intention." Oh, you poor love, that sounds rubbish.
And it's really uncomfortable when you've got sore nipples like that. Nobody can underestimate that pain and how it makes you feel every day.
It's always worth trying different positions to make sure that, because it's in one localised area from the sounds of it, that you maybe are putting your baby on in a slightly different position so they're not aggravating that area. That might help. So, if you're feeding across in cross cradle position, maybe trying underarm or upright. So just thinking about different positions to take that stress off that damage. And it does heal very slowly, but what should be happening is it's healing from below. We talk about moist wound healing, and that it's healing from below. And as the last bit that looks better, healed, is the surface. So hopefully that's what's happening to you. It is still worth looking at positioning and attachment. It's always worth looking at positioning and attachment. We always say that,
There's
don't
always
we?
room for improvement.
Always room for improvement. I can remember, we've met mums when we were seeing babies that were older, right up to a year, where you'd make changes. Sadly, we can't see babies that old now. The health visitors are covering that area now and doing a fab job. But so from that point of view, we do know that there is always room for improvement, no matter how old the baby is, how long you've been feeding. It's always worth another look.
And I think if you've got good attachment on one breast, it may be that you're just slightly out with your breast that's sore. If your baby can feed well with comfort on one side, that's probably your more dexterous side. And sometimes, I'm sure you've done this, it's like teaching you to suck eggs after 5 weeks, isn't it? But mimic where you're holding your baby on the side that's good, and just slide it across, so that perhaps it's underarm, or if you're doing underarm feeding, slide your baby across your tummy so that it's cross cradle, and imagine that your baby's suckling on the side that you're good at, and you might find that it's less painful, that you're tricking them to think that they're on the side that they prefer. And sometimes that works, sometimes it does. And I think also things like OBS, Oxfordshire Breastfeeding Support, La Leche League, see if they can do an attend anywhere Zoom appointment with you, just to see what's happening again. Can your health visitor watch what you're doing locally, so you're not having to come very far? Baby catheter now being done is very good. We're nearly out of lockdown again, I hope, fingers crossed, and things might start to move again. And if you're really struggling still, then give us a call again and talk to us. But use your local services first to see how you get on, and try and just trick your baby to thinking that they're on the good side, and that might help.
Amina's put a question here. Thanks for these great sessions. I breastfeed my daughter and I'm due in a couple of months with her older daughter. When I started to work, my milk depleted rapidly. I struggled to get any milk from pumping. How do I keep my milk production up and be able to get a bit of milk stored in case I need to go anywhere? Also, any advice on sore nipples? I remember with my daughter it was horrifically painful, and she ended up bleeding in the first few months. I think the first thing to say is that your knowledge of feeding is like way up here now compared to the first time round, and that makes such a difference. Although you're going to have a new baby, we talk about a new dance partner, but actually your understanding of feeding is so much further on than your first time round. And I think if it is sore, first and foremost, get help. We've just said positioning and attachment is absolutely crucial to getting feeding right, so do not struggle on in pain. Get help, get someone to watch the latch, make sure it's as good as you can get it. Pumping, any suggestions on that one?
You don't say when you're going back to work how old your baby will be, so how soon into your postnatal period it'll be. Sometimes when mums have a period, their supply drops down, and it might be at around about that time that you started having your periods again and ovulating, and that sometimes reduces your supply. Sometimes starting different contraception can impact your supply, but also if you've increased and introduced solids, and you're not breastfeeding as frequently because your baby's having more regular foods, that sometimes can drop the supply. We always say food before one is for fun. So you always give a breastfeed before you give your solids to your baby before a year. So they are always offered a breastfeed first, and you might find that if that happens, that they maintain their milk supply a little bit more. So it depends when you're going back as to what the advice would be. So I think your health visitor is very good at supporting you in day-to-day preparation for work and management with babies and things, juggling as you will be. But also the local support, La Leche, things like that, they do lots of groups on feeding slightly older babies and introducing foods and things like that. So there's lots of help out there if you want it. And obviously you can ring us and we can talk to you. If your baby's over 6 weeks, we won't be able to see you, but we can always advise you if you're struggling. But your health visitor that's what she does. So do tune into her as well and ask and see if there's local sort of weaning online groups and things like that, or later older breastfeeding groups. Something like Kelly Mom is very good. A website online, Kelly Mom, MOM. It's an American website, but it's very good about milk supply and feeding babies and stuff like that. So you might find that helpful too.
Yep. And the other thing to say is that obviously many women find that they have more milk than they need in the morning, so you could always just be doing a 1 pump session after the morning feed if you want to have a stockpile, and that, many women find that works well for them. Thank you for that, Amina. Moving on. Charlotte's come, one of our very, very main regulars. She's telling us that baby Alicia is now eating stage 1 to 2 food, and she's nearly 7 months old and has 3 teeth. Wow, well done.
Well done.
She's doing such a great job.
It doesn't take long for them to grow up, does it?
I know, it seems amazing. In fact, that's about the length of time we've been doing these sessions.
And actually, when you breastfeed and you're having problems, it feels like a lifetime,
It
doesn't
does,
it?
it does.
Absolute lifetime. But when you look back, you think that 2 weeks where you were struggling, it's like a minute in time, isn't it? So, well done for getting that far. It's fabulous.
Yeah, well done. Manon has said, hello, thanks for answering our breastfeeding concerns, with a lovely smiley face. Almost 2 months after giving birth to my daughter, I still have my breasts leaking heavily when I'm feeding her, especially in the morning when they haven't been emptied for 6 to 8 hours.
Oh, you lucky thing.
Yeah, everyone else is going to be jealous.
Quiet.
It's so bad that I even have milk spurting out like a fountain, and I can collect up to 20 mils by just letting them drain. I tried different techniques, expressing manually or using a pump, offering just 1 breast for each feed and keeping to it for 2 hours, but no luck so far. I currently have to wear a collector shell on the breast my baby is not feeding from, and be very careful when she decides to release the nipple. I've already squirted milk all over the sofa and books and around. Wonderful. Which makes it very difficult to breastfeed in public. I bet it does. I thought this would stop around 6 weeks, but it hasn't. Any advice? Should I see a doctor to check whether there's a particular reason behind this? Many thanks. I'm not sure a GP would be able to help, to be honest. How old are you?
Is
2
your
months.
attachment really good, or is your baby quite shallow on the breast? You know, does your baby have a really deep latch? Because sometimes if they're just on the end a little bit, which is very easy to do as they get older and they just help themselves a bit more, and you can still improve things a little bit if your baby is still 8 weeks or more, but try and work and just check that the latch is really deep, and that they're not coming on and off all the time, because if that happens it tends to overstimulate your milk and you tend to get very full. Some mums that have got medical issues like polycystic ovarian disease, they sometimes have more milk than they need, and actually having too much milk is as hard as having not enough milk for most mothers. It's a real hassle for you, you know. It's
We'll get the country there, because we also have mums with that problem,
that have, yes,
who
and so
do
some
not have
people
enough.
have too much milk with PCOS, and some mums don't have enough.
Exactly.
But if you have too much milk and you haven't got PCOS, which is quite possible as well, it is hard work. It's really difficult, and it's really hard to deal with it on a day-to-day basis, because your baby gets really quite spluttery and quite unsettled, because the volume of milk gets really pushed in. And also, if they're not draining the breast well, sometimes they get lots and lots of you know, the fore milk, which is more lactose led, and they can get quite explosive nappies and things. So you know, getting a really good mix of milk is really important, so that they feel happy and satisfied and can go, you know, good time between feeds. And if your baby's constantly on and off the breast, it could be hyperstimulating it. Be careful with collecting shells. They're great because you're leaking, but if you wear them outside of that, just that little bit of time, it can overstimulate your breasts as well to produce more. So use them carefully if you're using shells.
I think she said that she's using them when she's just feeding.
Absolutely.
But I think the 6 to 8 hours is quite a long time. I'm not surprised you're having a big leak at that point in time, because that is a very long time to go without any milk removal, don't you think?
Yeah, some mums find block feeding is quite good, but you have to do it really carefully, because if you do it too soon, you can dump your supply down really quickly and then end up with not enough milk, which can be really soul destroying when you've had too much. And so you might want to Google block feeding just to understand what it is, but generally you feed on the same side for 2 or 3 feeds, and then you go to the other side for the other 2 or 3 feeds. So it might be a day and a night that you're breastfeeding. So what it sometimes does, if you do that for sort of 48 hours, it can 36, 48 hours, it can damp down your supply a little bit, and that sometimes helps to get back on track with mums. But I would say, is your attachment really deep? Because that's the one thing that mostly creates oversupply, is that your baby's on the end of the breast a little bit too much. And if you can get your baby on slightly deeper, it might be that they drain the breast more effectively, and then the cycle is broken of oversupply. It's really difficult. So you know, do use the local services. and or ring us and talk to us, but unfortunately we won't be able to see you at 8 weeks, but your health visit support should be able to, as well as the local services and support. But we're very happy to talk to you if you want to call us.
Like, I noticed that you've said, you thought that it would be getting better at 6 weeks. We think it's sort of 6 to 8 weeks your milk supply starts to match what the baby's asking for. So there's still time for it to start, to regulate a bit better. So I wouldn't lose hope that it may just sort itself out. But
I hope your baby's happy with what it's getting.
Yeah, I hope so.
As long as your baby's happy, you can get through the day. But if you're miserable and you've got lots of milk, it's really tough.
So if need be, get in touch. This is a name we know, Katie Depova. Hello ladies, so good to see you both again doing these sessions. I just wanted to thank Naomi once again for her support this morning. That's why I say I knew the name, because she'd been in this morning with baby Valerio's feeding. As soon as we arrived home, his nappy was super heavy. Fingers crossed for our next week plan. Brilliant. That's good news. Yeah.
Fingers crossed indeed.
Yeah, that's lovely. Lucy has said, another question, sorry, no, don't apologise, and thank you for your great advice. I found there is much conflicting advice on the age of your baby and the frequency of feeding that's recommended. I've been told by community midwives 3 hourly and not to leave baby over 4 hourly in the first month. At what stage is it okay to let baby sleep for longer periods if they don't wake for feeds, and how long is safe to let them go without feeding? If your baby is meeting all its milestones, which is what we talk about all the time, pooing and peeing or weeing and pooing appropriate to age, gaining weight, let your baby tell you when they're hungry. Absolutely, isn't it?
8 to 13 feeds in 24 hours. You don't have to go by the clock, as long as there's a number of feeds in the 24 hours that your baby needs. And actually, some babies don't feed that often and do well, but it's unusual and we wouldn't recommend it. But I have seen some babies at 6 weeks that have had 4 feeds in 24 hours and have put on a pound a week. So you just cannot tell. So that's why you shouldn't look at the numbers. You should look at what your baby's achieving. So if at night your baby's not wanting to feed at night, then and you're getting that number of feeds in 24 hours that you need, and they're happy, and they wake up and feed the rest of the time okay, then leave them to sleep for a bit and just see what happens. You'll be terrified the first time you leave it for five hours to sleep because you'll be full and you'll be worried about your baby. But if everything else is okay, if your baby's not gaining weight and it's not doing all the things it should be doing, then you mustn't leave it that long. But if everything else is okay and you've got a good milk supply and you feel that everything's okay, then it is okay to leave your baby to sleep and wake up spontaneously. They're going to feed much more effectively if you do that. Just the thing about supplying more than 6 hours, that it can damp your supply down a little bit if you leave long periods between breastfeeds. But some babies only feed when they go to sleep and then first thing in the morning, and that could be 8 or 9 hours, but they're usually a little bit older.
And obviously Manon's baby is doing this because she was saying her baby's going 6 to 8 hours between feeds at night. So I think it's a case of seeing what your baby's doing, and as long as they're meeting their milestones, we don't worry about them. And there'll be some times where your baby might sleep longer, and others when they won't. So even babies that do begin to do that for a little while, they're likely they may start waking more frequently again. Babies don't get
guaranteed.
it. Yeah, we talk about babies don't go into routines. They don't do it. So
time. And if you have a long sleep, they will cluster feed. They will be starving if they've had a 6 to 8 hour sleep. They'll be starving when they wake up, so they'll feed perhaps 2 or 3 times in 3 hours because they want to catch up and get the calories in. So as long as they're doing that, that's fine. It's absolutely fine.
Yeah, we often talk about the fact that in a 24-hour period, babies need an amount of milk, and if they have, some babies will feed all day and sleep better at night, and some babies will feed a lot in the day, and not at night. So you get these swings and roundabouts. So you have people saying, "Oh, my baby doesn't really sleep," or "My baby feeds lots." Well, you've got to look at the whole day. What's your baby doing? Is it getting on average 8 to 13 feeds in a 24-hour period? Frequent, not regular, and then that would be normal, and that's normal for your baby. Every baby's slightly different.
And don't class your baby as a good baby if it sleeps well, and a bad baby if it doesn't, or anyone else to say is your baby good. Your baby does what it does, and your breast capacity, the ability to hold the volumes of milk in your breast, is not the size of your breast, but what the volume it will be able to hold is different per woman. So if you've got a smaller breast capacity, your baby is going to have to feed more frequently to get the same amount as a woman who's got a large breast capacity less often. So it's who you are and who your baby is, and that's how it works out. It's not about books and this is what your baby has to do. Look at your personal profile, your own personal picture about it.
Yeah. Charlotte's come back. I found I've got so much more confidence becoming a mum, and I'm loving being a mum and loving your sessions, so I'm learning more. Thank you, Charlotte. We're glad that you find them so useful.
We love doing them.
Yeah. Jane has said, our lovely Jane Joyce from OBS, lovely to see our favourite maternity infant feeding team, with thanks from all at OBS. And La Leche, yeah, thank you for all you do at OBS.
Absolutely.
So we are so lucky to live in Oxfordshire with OBS, La Leche, Abingdon Baby Cafe, and our health visitor teams as well. We are really lucky.
There's lots of help that you don't need to pay for.
Yeah. Tamara has said, my baby is 5.5 months and has 5 to 6 ounces every 3 hours and 7 ounces before bed. She's been sleeping through since she was around 8 to 10 weeks, but recently wakes in the night for a few hours before going back down again. Any ideas why this could be?
How old is she?
She is 5.5 months.
So that's about 20 weeks, 22 weeks.
She's getting near weaning, isn't she?
Yeah, she's probably saying, I'm nearly ready for food, Mum. Not quite, nearly there, a couple more weeks.
Yeah. Yeah.
She's telling you she's nearly ready.
Yeah.
And you'll know when it's right. And it'll be up to you and your baby when you decide to start. But the recommendation is 6 months of exclusivity.
Yeah.
Around about. It's not an exact science. So if it's a week before or 2 weeks after, that's okay. As long as they're meeting what they should be doing and everything's fine. So it sounds to me like she's nearly ready.
And it's like we just said a minute ago about, babies might sleep for a period of time and then start waking again at night, and that's not uncommon. She might be looking for a bit more food, so you could try and see if she wants a bit more food.
Bit of growth as well.
Yeah.
Sometimes if they have a bit of a spurt in growth, they just want a few more calories to kick them in the right direction.
So, and then you get you to the 6 months, and then you can think about offering those other foods. And as Naomi's just said, any food before 1 is just for fun. So, whichever way you go, whether you do baby-led weaning, which is obviously very popular, or you tend to go the more pureed route, then those foods are there for her to learn how to eat rather than actually give her calories. The calories are still coming from the milk that she's getting. So, well, good luck with that, and I hope things improve and you get your sleep back again. Moving on down, Francesca said, hello, my baby's almost 8 weeks old now and feeding well. Brilliant. When he was first born, he spent a few days in the excellent care of the JR Skaboo. And if anyone doesn't know, that's the special care baby unit or the neonatal care unit. And I was really grateful for the donated breast milk he received. I'm thinking about returning the favour by donating my own breast milk now, but I'm worried about ending up with an oversupply. Is this a risk, and do you recommend any particular age of baby to start donating? It's whenever you've got any spare. We'd be delighted for it. Amanda Wood, who runs our milk bank, would love to hear from you. I think, as I mentioned earlier, many mums find they've got more milk than they need in the morning. So many mums will find if they breastfeed their first breastfeed of the morning, and then they can pump afterwards and get good volumes. So from that point of view, that's a really good time to to have a go at feeding. So have a think about that.
They like you to donate about 20 bottles in your commitment to them. So that's 20 bottles of about 100 mils, and they give you all the equipment. So they do blood test, and then they will send you the equipment, and then a courier will come to the house, and they will collect the milk and take it frozen. So, but you don't have to do it all in one go. You can take a little bit off and then put it in the freezer, and then take a little bit more off and put it in the freezer. You've got to just make sure that everything is sterilised and clean, and your hands are clean, because if it's contaminated, they can't use it. And actually, we've had a little bit of that in the last couple of weeks, where there's been a couple of contaminated donors, so we haven't been able to use the milk. So make sure you're scrupulous with your hand washing and everything if you're doing it, so that it doesn't get discarded, because we can't use stuff that's got infection in it.
I think the thing to bear in mind is that we all live in our own bugs, and our bugs are fine for us and for our babies. We all have our own bacteria. We all have our own skin flora. We all have that. But actually, when it comes to babies on the special care baby unit, they're obviously very vulnerable. And whilst we talk about not worrying about having to sterilise, pumping equipment and everything when you've got a baby that is term and healthy and no risk factors, when you've got babies on the special care baby unit, we do have to be really cautious. So that's why when mums are donating, they're requested to wash their hands, to really wash their hands, make sure all the pump kits are sterilised and the milk is checked, and it's a bacteria count that they check. So it's a case of your milk, don't worry about your milk is absolutely fine for your baby. It's just when it's being donated we have to be a little bit more careful.
A very high benchmark to get through the testing, much more than everyday milk. So for your baby. So yes, so they'd be delighted, absolutely delighted for you to donate if that's what you'd like to do. Any mum, and it's up to about a year, I think they'll accept milk. So and
there was some research come out recently, wasn't there, saying the milk does not change its nutritional value right up to 2 years. There's talk about whether the milk banks will change their regulations and carry on taking it after a year, which would be great, because obviously that means some of the donors who stop donating would be able to carry on, which would be brilliant. So, but, anyway, so that'd be fabulous, Francesca. That would be lovely. Thank you very much for thinking about it. Emma has said, let me find her message again, can I hand express antenatally? If so, what's the current advice? Well, actually, we've just had a leaflet printed.
With us, have we?
No, we haven't. We're so excited. It has taken us a very long time to get this leaflet put through. It's been quite a while, because there's a very, thorough process to make sure that it's written well and it meets trust guidelines. But it is finally out. And actually, if you check our website, if you go to OUH, then look at maternity, and then look at feeding, there is a guide to expressing when you're pregnant on there. So have a look, Emma, because you'll be one of the first people to look at it, because it's literally just gone onto our website. So be one of the first people to look at it. But the guidance usually is 36 weeks to maybe have a go, 37 weeks to start expressing, and maybe trying it 4 times a day from 37 weeks onwards. Not doing it earlier than that. We don't, although there's very little evidence to prove that it could put you into labour, we don't want to risk you having a preterm baby, so we would highly recommend waiting till 37 weeks. There's some great videos out there, things like Global Health Media have some great hand expressing videos that you can watch. I thought, are you going to pick up a breast and do some hand expressing?
I can do, but I think more it's just that you can get syringes from your midwife and get her to show you when you have your 36-week appointment.
Perfect.
Have a little chat with her about how to do it, because that's really nice, and you can show her your skills as well. I'll do a quick run through should you want that. And so this is what you do is you do a little bit of massage and make yourself very comfortable, because you don't want to feel observed, because oxytocin is a very shy hormone and it only comes out to play if you're relaxed. So you need to be happy, you need to be unobserved and feel comfortable with what you're doing, and it shouldn't hurt. So a little bit of breast massage, and that will just stimulate the ducts to start to warm up and to be primed. And then you go to the base of your nipple, so and then go back 2 to 3 centimetres behind and make a C with your thumb and your finger, so you're making a C shape like that. And then just push back slightly and then hold your breast down. So you don't want to be rubbing. Rubbing is not good, because
no slipping.
Will hurt you. You've got to put your fingers where they need to be, and it's really pincer. It's a pincer action. Imagine you're putting your finger and your thumb together inside your breast, and you hold that and then release. About 4 seconds. Push back and hold and release. Push back and hold and release. And then when you see that they're little, you might get a tiny little glistening bits, you might not get anything, you might get drops. You walk around your breast with your fingers, so you can, like a clock face, you can go all the way around there. And when you've done that, you go to the other breast and do the same, massage slightly, do the same expressing again. And when you've done that, go back to the side that you started on, because you've got the flow going a little bit then. So you might see then a little bit more coming, and then you go back to the other side again. And you can collect it in a syringe. That's quite difficult when you've never used the syringe, but it's very doable, and you might have somebody at home that can help you. Or you can use a little cup, any cup, egg cup, or a spoon, or ice cube tray, tiny little ice cube trays you can use and collect little drops, and then you can freeze it. And then we wouldn't recommend that you bring it into hospital when you go into labour straight away. Don't bring it all in one bag, because if it defrosts, you've got to throw it away if your labour is, it's 24 hours, and you don't go into labour and you'll put some, you're waiting to go into labour. It might get mislaid or put in a fridge rather than a freezer. We don't have access to lots of fridges and freezers in the unit, so don't risk it. Keep it at home, and your partner can bring it in when you've had your baby, and then you can use it as you've had your baby, or if you go home very quickly, you can keep it at home and use it at home. What we do say though is if you have got lots of colostrum harvested before you've had your baby, that you make sure you still hand express after you've had your baby, because you can't take your foot off the accelerator. You've got to do that early stimulation. Going back to what we said first thing, go to the early stimulation in that first 24 hours where you've got to prime and start priming your breast to make milk. So you cannot take your foot off the accelerator. The clock starts ticking when your baby is born, and you've got about 14 days maximum to really stimulate your supply to make a full supply. And in that time you've got to be really busy with breastfeeding and hand expressing and skin to skin in order to secure that supply. And once that's secure, then you can keep making milk. Even if you pull back a little bit, you can go back to making more if you need to. But you have to be really, really vigilant, and I've said it lots and lots of times on here, you've got to do it yesterday, not tomorrow. You cannot do it tomorrow, because tomorrow might be too late in your little window, and then your supply is low, and then you'll be into the breastfeeding clinics with low supply and your baby's not gaining weight. So you really know that you have got to get onto that as soon as you can. Do lots and lots and lots of stimulation with lots of breastfeeding and lots of hand expressing if your baby's not attaching well, because you can secure and protect your supply, and then you can do anything. But if you don't have the milk and your baby's not feeding well, it's really, really hard and really soul destroying. And there'll be many, many of you listening to me now screaming, saying, yes, just do it. Because for all the things that people say, when they come to see us, they say, I wish I'd known I had to have done what I did. And they will have been told that they've been tired, sore, I'll be all right to do it tomorrow. There's always an option where you can have an extra hour of sleep, but actually that takes hours and hours to catch up with if you miss that little window.
It's such hard work when you have to build up a supply, and although we talk about that 2-week window, we know that for some women those first few days are utterly crucial, and if they don't establish their supply in the first few days, that actually it has such a knock-on effect. And we meet mums who've had done a fantastic job expressing before they've had the baby, and then really struggled afterwards. So just because you can do it before doesn't mean that as Naomi says, you can take your foot off the pedal. You've absolutely got to keep going.
If you've got medical issues, if you've got thyroid issues, if you've got endocrine issues, you really need to be on top of your milk supply. So if you feel that if that is you and you're pregnant and you're not sure, then make sure you get support in the really, really early days to get those breast cells, the milk cells, the prolactin stimulated to produce that milk and really raise your prolactin levels. Because if your endocrinology is slightly imbalanced, it will affect your milk supply to a certain extent. If you've had a cesarean, you are more at risk of having delayed milk coming in, because you don't do quite as much skin to skin. So you really have got to get your skin to skin tip top when you're in theatre, even if you feel shaky and cold and somebody's rummaging around inside your tummy and you feel faint. It's really hard to be positive about giving your baby skin to skin. So you get someone to support you, get someone to hold your baby close to you. It's lovely if your partner does it, but it doesn't make your milk. And that first hour is really crucial. So if you can't quite do it in the first hour, do it as soon as that is possible within that time. So when you've been feeling a bit better, you're a bit warmer, you've been moved around to another ward, then make sure that you can do skin to skin and just prolonged skin to skin and lots of priming of your prolactin receptors in your breast, so that you really hit those levels to make the milk when you need it. Most of our babies that come back in with weight loss have had more instrumental deliveries than the normal deliveries that you see where they've had no intervention, because you're not getting the same stimulation, because there's lots of distractions and you're exhausted and you might not be well and your baby might not be well. So do it as soon as you can. If your baby's not well, if you're not well, do it as soon as you can, and then you just keep going.
Right, So hope that helped, Emma. That was quite a long-winded answer, but I think
Sorry.
it's so valid for so many people.
We've got lots to say.
Yeah, always, because we just know what we see when mums come in when they're struggling, and we just don't. If you're out there and you haven't had your babies yet, we really hope you won't be one of those. We're really hoping for all the right reasons that we don't meet you. And that's, that's not meant in a nasty way. That's meant because if we don't meet you, it's because you're not having problems, and that's a really good thing.
We shouldn't see any of you on the postnatal ward,
Hopefully
hopefully.
not. Much as we'd love to meet you in person.
We would love to, but that's, we are here to support the staff with more complex issues that they're worried about.
Yeah.
So if your baby's a bit sleepy in the first day, and hasn't quite suckled yet and things like that, we shouldn't need to see you for that. We should see you if you've got medical problems or there's problems with the baby. So, but we will always support, and we will always advise the staff and support them as much as we can, because they are skilled at doing the normal and supporting mothers to breastfeed. I know it's busy, but they are skilled to do that, and we want them to keep those skills brilliant. So, we shouldn't need to come in and see you.
So moving on, that was that answer. Charlotte's just said all the midwives in Oxfordshire are NHS heroes. Thank you. It's nice to know that's how you feel, Charlotte. Tamara has said, thank you so much. I thought it could be that. She was having 6 or 7 ounces before, but she hasn't seemed interested in her milk as much lately. Things come and go. Babies change what they want. So just go with her, Tamara, as much as you can. And going back to what we've said a number of times, as long as she's meeting her milestones, as long as she's weeing and pooing appropriate to age and gaining weight, then don't worry if she has a period of time when she's, perhaps taking a little less. Francesca's come back and said that's really helpful. Thank you. Brilliant. Glad we've met your needs. Madden's just come back. Thanks for the feedback. I'll just keep going as my little one seems quite satisfied after the feeds, and hope the flow will just go down in the coming weeks. Another 2 questions, if I may. My baby is cluster feeding about 7 p.m. every 40 to 60 minutes, which was exhausting around 3 to 4 weeks. Is that going to calm down, or on the opposite, is it going to become more intensive as she sleeps longer at nights? Also now, I'm only breastfeeding her. No more express milk top-ups, you star. She doesn't want to take the bottle anymore. Yeah, that's quite normal when they realise how much they love the breast, which is annoying when I leave her with Dad for a few hours. Any advice would be gratefully appreciated. So the cluster feeding is normally fairly short-lived, isn't it?
Certainly the first 3 months they may do it for. Certainly, 8 to 12 weeks they start to settle down a little bit. Are you pumping as well? If you've got slightly too much milk, are you pumping still? I think you just said you were collecting, didn't you?
Yeah, she was collecting because it was leaking so much. Yeah,
so if you're pumping, pull back a little bit maybe if you've got lots and lots, and don't overfeed in the evenings if they're very unsettled. Because the cues might not be that they're really hungry. Make sure that they've had a really good feed. They've had the other side. They've got a clean and dry nappy, and then maybe get your hubby to hold her and take her for a walk so that she has a little bit of a break, because sometimes you can overload them and they get tired and they get full and they're not very hungry, but because they're crying you think they need food, and actually they might not want, they just might want to be walked around and have a cuddle, and I'm sure you've done all of that in the time you've got.
But that cluster feeding may also be contributing for how long she's sleeping at night.
Yeah, she might be tanking up.
And that's what we always feel, that's what we say to people, is that when babies are cluster feeding, they're learning how to take a bit more on board so they can sleep a bit longer. With regard to the bottle, I think that's just a case of keep trying, but make it fun. Don't do it when she's desperately hungry. So, when you leave your partner to feed the baby, make sure she's not really starving, because that's just going to set up a negative situation and a negative cycle. So keeping it as nice as possible, letting her play with the bottle in her mouth, and not making it a big deal. So don't leave her starving and think she's going to take it. You're better off leaving her mostly full and then see if she'll let Dad give her the bottle then, so she realises. Yeah, exactly. Don't try when she's starving, because it will just become a big fight, and actually you'll be the losers and she'll win. So.
And I remember that mostly if they're cluster feeding in the evening, the milk has got about 18% more fat in it in the evenings, so they're getting more fat but less volume a lot of the time, and a lot of you may feel that you haven't got much milk in the evenings, but they're getting 18% more fat. Yeah. And that's really important to know, that you're doing a good job whatever you're giving.
It's a bit like me sitting there eating chocolate in the evenings. I'm good all day, I eat chocolate in the evenings. Laurie's come on and said, "Hi ladies, thank you for these wonderful sessions." Thank you, Laurie. We like, oh, so it's Laurie Betty, her name is, sorry, I've shortened your name. We do like to have the feedback. It's really nice to know that you find them useful. It is a bit weird to sit here looking at a phone talking.
I think is this number 31?
It's something like that. We've been going since April, so... Tamara has come back again. She goes, "Me again." As I said before, my baby's 5.5 months. When I had her, I suffered a 3A perineal tear. Oh, you poor darling. And my placenta didn't come out naturally and required surgery. My bleeding after birth stopped after 6 weeks. But since then, my periods are very irregular and heavy. Since September, I've had 5 week long heavy bleeds. She's on Deserex. Do you advise I book in to see my GP? Yes.
Have a talk to them.
Yeah, definitely.
Might be that you need to be followed up a little bit.
Sorry, the message is scooting up and down. I'm guessing yes, but didn't know if this was normal for after birth to have more irregular heavy periods. We wouldn't expect you to have a 5 week long heavy period, so I think yes, go and have a chat with the GP, make sure everything's all right. You know, they don't come particularly regular straight away once you start getting them back, but yeah, we wouldn't expect you to be bleeding for a long time. It won't do your iron levels any good. So good luck with that. Pasqualina said, "I'm 37 weeks pregnant and being told that I'm likely to deliver a small baby. Can you offer any advice for the early days of feeding? I'd like to breastfeed. Baby's weight is currently estimated at 5 pounds 2 ounces. They're not absolutely tiny. But, so I think maybe, as we've talked about already, is thinking about
first hour.
Yeah, skin to skin in that first hour. Maybe trying, maybe even doing a bit of hand expressing. So know what you're doing. You know that if you can know what you're doing before you come in, even if you don't do much and don't collect it, just learn how to hand express before you come in. Because ideally, once your baby's born, it's you that's doing the hand expressing if you need to give additional milk to your baby. And if your baby is small, then they're going to be what's called small for gestational age. If they're put on a centile chart, and if they're below the 3rd centile, then actually we will be following your baby more closely and be expecting them to have more feeds. So having a little bit of express breast milk, whether you do it before you've had your baby or start expressing as soon as you've had your baby, would be handy. But knowing how to do it before you come in would be really good. Learning that new skill before you're faced with that time after birth when you're tired is a really handy thing to do. So go and watch some videos about.
And we've got that marble again. You can show that again. It's on your lap, isn't it?
Oh yeah, yeah.
So that's your baby's tummy, and that's you know, don't fill it. That's the most important thing. And I think one of the things to say is that you have to trust your body that small amounts, tiny little amounts of colostrum is enough for your baby, because certainly in the first 24 hours, if your baby is normal, healthy term baby and a normal weight, and is not under, you know, having blood sugars done and things, which we would say if your baby is small for gestational age, or you're diabetic or something like that, then your baby is more at risk, or you've got any reason your baby's had a temperature, or it's poorly, or it's under the paediatricians, then this doesn't apply to you. But if it's a normal, healthy term baby of a nice weight, just small amounts, particularly in the first 24 hours. And, you know, when we talk about small amounts, you really mean small amounts. And this is a 1 ml syringe, and we might say, yes, you might be able to. You might be able to then see that there's lines on it. Most of you that have had babies will be have a very good relationship with these, because you'll have all probably had a go with them. But 0.1 ml of express colostrum is like a tablespoon of golden syrup. You know, it's really high in goodness and calories, and helps to support your baby. But the other thing is that, you know, the first 24 hours or so, 36 hours, it's not about the food, it's about your baby getting used to being outside of your womb, outside of, you know, your body, and they're adapting to that. And they've got lots of fat on them, which they helps to maintain their blood sugar levels themselves. So they burn the fat if they're not getting much calories. The other magical thing is that they have something called antidiuretic hormone, so they don't pee very much. So it's what we produce at night as adults and children, so we don't pee at night as much. So they have this hormone that they release to stop them peeing too much, to get more dehydrated. They need to pee, they might pee once or twice in that time, but most likely very, very tiny amount of wee. So the small volumes of colostrum are really important to give your baby the calories, small amounts of calories, but also it means that you're priming your milk to be stimulated to start production. So that hand expressing or the breastfeed that your baby's having, which is even better because they're far more efficient than hand expressing, that means that they are starting the process of just learning to be outside of your womb. Once you get beyond about 24 hours, then your baby should be fed more frequently. And the other thing to say is the volumes in the syringe should go up if it's still colostrum.
Mm-hmm.
So you need to then start to make regularly hand express, so 8 to 10 times in the day, and your baby's tummy at about a week is slightly bigger. So you can see it's getting a little bit bigger, but you still don't need to fill it. So if you're worried about your baby in the first day in the hospital, it doesn't need any more food unless it's medically indicated. So don't feel that because your baby's waking up and feeding a lot, or you're expressing and giving small amounts of colostrum, that you need to give anything else to your baby at that time. Think about your baby's tummy size. Small amounts, but the frequency of the feeding every day should go up. You should be feeding your baby more, and you shouldn't be waiting for anybody to tell you that. You should be using that as your guide as parents, that your baby needs to have more food every day that it's older. And this is where you go for the conflicting. On day 0, they said, oh, your baby only needs to feed 3 times in 24 hours. The next day they'll say, oh, you need to feed your baby now 8 times in 24 hours. You need to start that process going. And then the next day they'll say, well, actually the volumes in your breast, you need to be giving more milk to your baby. And the volumes will start to go up. And you will see that if you hand express, that you're getting more out of your breast. So your skills will improve, but also the volume in your colostrum will go up slightly, and you'll be getting more and more. So don't feel that because your baby's not getting 20 or 30 mils of food on the first day that it needs it. Think about that baby's tummy size. Think about the next tummy size in a week, and then when your baby gets to about, I think it's about a month old, isn't it?
Yeah.
This is how big your baby's tummy is. So it's not big, even
So
after all that time. It's not big. You don't need to overfill these babies' tummies. And it's really important that you understand that actually they need frequent feeds, but not lots and lots and lots with colostrum. Then your milk starts to come in on about day 3, the end of day 3, and then your breasts will start to feel fuller, they'll start to feel a bit heavier, they'll be more veiny, and you'll be quite warm, and you'll find that the volume of milk that you're getting out, the hand expressing will change, and you will also, if your baby's suckling at the breast, is that you'll hear your baby swallowing more, and they'll be a little bit happier. So the first night after your baby's been, the second night we should say, not the first night your baby's born, the second night, your baby will be very busy.
Yep.
They
Chasing
will be
milk.
feeding all the time,
Yeah.
and that doesn't mean you've got to give it more food. It means that it's making the milk, and it's priming your receptors in your breasts to make the milk. It's not starving because it's doing all the things it can, and it's burning the fat that it's got on its neck, all of its body. They've got that lovely layer of fat, and your baby's burning that fat to keep its brain fed and getting colostrum. And then it will feed, and you'll be awake all night. And it's usually when you've gone home and you think, oh goodness me, my baby's not getting any food, I'm starving it, and I don't know what to do, I think I need to give it some extra food. And you shouldn't need to if your baby is well.
No.
You have to trust your body on that one. Hand expressing is your emergency care.
Yep.
This is your emergency care, so you can express milk. That's why it's so important to have that skill. You can get milk out of your breast if you have a good technique, and the more you practice, the better you are at it.
And the more you'll get.
The more you'll get. And then after about 48 hours to 3 days, if you really are struggling, you can go to a breast pump if you need to. But you shouldn't need to pump before that. So hand expressing is much more efficient, and it's very thick and sticky, the colostrum, so it doesn't come easily and flow into a breast. In a breast pump, it sticks to the sides.
Which is why we use syringes, because we can collect it in the droplets that form on the breast.
But also, you shouldn't be using syringes after you've got mature milk. So once your colostrum has changed, that'll be after about 48 hours to 3 days, you shouldn't be using syringes to feed your baby, because they're not suckling, and the milk can easily be aspirated. They can breathe it in. If they breathe in as you give it to them, it's loose in their mouth. The colostrum just coats the tongue, and they take it in because it's small amounts. But once you get the much more runny, mature milk, you shouldn't be giving any food in a syringe.
So, I've got more questions coming through, and totally relevant this one.
5 more minutes.
We've got quite a few questions wrapped up. Laurie Betty has come back saying she's confused about expressing. She's 38 weeks and 4 days pregnant. Do I need to express colostrum, or can I wait until the baby is born and breastfeed then? You can wait. If you have any risk factors, so are you a mummy who has diabetes or a woman who has diabetes? Is there any concerns about your baby? Those are the mothers that we'd be suggesting that they hand express before they come in and collect some. It would be well worth, as I mentioned a few minutes ago, just to go and get your head round what hand expressing means. Just have a go. Don't have to collect it. Just so that you know that when you come in, should your baby have any problems attaching at the breast, you can do it, because it's much better that you're doing it. And if
you will be very tired when you've just had a baby, and you'll have quite a sore derriere. So I think learning that new skill is much easier at this stage while your baby's still inside than after you've had your baby. So maybe go and have a look there. I said to Global Health Media, I've got some lovely videos for mums about breastfeeding. They're aimed for the whole world, so they're really multicultural, they're absolutely gorgeous. So go and have a look at their hand expressing one, and it's really, really good. And even if you don't do it yourself, just go and get an idea of what it entails, so that should you need to hand express when your baby's born, because some babies don't get it straight off, then actually you're ahead of the game. You know what you're aiming to do. So good luck with that, Laurie Betty, but you don't have to do it. Not at all. You can have a practice and then not do anything, and you certainly can practice and not collect.
Yeah.
It's absolutely fine not to.
Shower, quite a good place to do it.
Yeah.
Manon has come back and said, awesome, thank you. That's brilliant, thank you very much. Tamara's come back, thanks for these sessions, ladies, they're so helpful. Thank you, Tamara. Tammy Murphy's come back and said, I had a breast reduction 16 years ago, wasn't unable to get any milk out when I had my little girl almost 3 years ago. She's 33 weeks pregnant and wondering if there's any point trying to breastfeed again. When I tried last time, I was on the pump for 20 minutes at a time and it was very painful and stressful. I'm not sure I want to put myself through it again. What are the chances?
For us to talk to us
yeah,
about all of
what are
that.
the chances of being able to breastfeed? Now, we would definitely think it would be well worth a chat. You're definitely someone we would talk to. We can do it over the phone, we can do it on a video call, but we do try and encourage the community midwives, if they know they've got women in their caseloads that have had surgery like you, to get you to get in touch with us. So actually, you've done it already. So get in touch with us, give us a call, or email us. So Tammy, that would be brilliant if we could hear from you, if you're local to here. Sometimes we find that mums are watching and they're not local, but if you are local, Tammy, get in touch with us, ring us. The number is on the website. I think it comes up on the end of these sessions as well, or give us an email us, and we'll have a chat through what happened last time and talk about how we can maximise any breast milk you can give this time without you having to have too much of a similar experience to last time.
And hopefully, we can see you in the hospital. That would be exactly who we would see in hospital if you've got issues.
Moving on, we've got 7 more comments. Lucy, my baby's nearly 3 weeks, and when breastfeeding, the first latch is so painful it then isn't at all making me feel the latch is okay in the end. Sorry, I think that's my reading. I'm sorry. Is there anything I can do to stop that initial pain, as it's so off-putting? Thank you, C. Thank you. So,
is anybody watching you and supporting you? I think that's the most important thing. Are you getting help? Do you have midwives nearby that drop in to see you, or is there a drop in an MLU that you're nearby that you can have some breastfeeding support?
I'm going to borrow the breath and just say that because you're saying it's the initial bit, and the one thing that happens when babies go on the breast, the only time they actually suck, the rest of it suckling, is when they take that nipple into their mouth. So if that's the mouth and that's the baby, and they can extend the nipple and areola complex up to twice its normal length in the process. So if you've got any residual damage, that's why it's hurting, and that might be what's happening, because you're saying that afterwards it's fine. So we would normally say 10, wouldn't we? Count to 10 slowly. So, and breathe. Use those breathing techniques that you've had when you were having your baby. Breathe through that. It should get better though.
Sometimes, can I borrow that lovely little baby on your chair?
Yeah.
A really good position you can try, which sometimes just takes the pressure away from your nipples where they're sore, is to lean back a little bit, so you're sort of 45 degrees, and you literally put your baby like a seal on top of you. They've got their hands on either side, and you face plant them. Literally, they're not on their side, because that's wrong. You'll end up in all sorts of trouble if you do that. You face plant them, and so put something in your lower back to support you, a pillow or a cushion, and then just let your baby put their hands on either side of the nipple on the breast you're going on. Your baby's feet should be going towards your armpit on the other side, and your baby's tummy button should be on your other breast, and let them just plonk on top of you. You literally plonk their mouth on top of your nipple, and sometimes they go on really deeply then and suckle, and that teaches them how to take the breast in the mouth, but it also is an easy way to get your baby to attach on the breast more deeply, because gravity is working with you. Have a go and see if that helps. It is a good position. It's a little bit easier than doing this position because their heads bob an awful lot when you start doing this, and it's when you've got sore nipples, it's really scary to think your baby might grab or touch your nipple in the wrong way. So sometimes just going like that just teaches them how to lift their head up and then take a big mouthful of breast and suckle. So try that position as well. It is really good for the early days when you're a little bit sore, and it just might give you an extra millimetre on the breast, which will take away that discomfort more quickly. Give it a try. Use OBS, local breastfeeding support. Your midwives, if they're still caring for you, your health visitors will be able to support you, and give us a call. We can talk to you as well. But just for positioning, just try this position and see if it helps.
Good luck with that, Lucy.
Absolutely.
So Aggie said, my baby latches on my right breast fine and I do not feel pain, but on my left breast the latch is really painful. I'm so confused on what's happening. Would be grateful if you could advise on how I could make this better.
I think you'd be a good candidate for that position again, and try that one, because it's the same on both sides, and the clue is if your baby feeds well on one side, it's possibly the dexterity that you have in the early days. You haven't quite mastered it in the right place on the side that you're not so good at. So if you do sort of face planting, you might find that that is easier. Have a little go and see, and also use local support to get someone to help you and watch you feed. It's really difficult when we've got lockdown like this, but we're coming to the end of it, so hopefully things will start to pick up again to help. Less than a week left, hopefully.
So good luck with that. And I always think you've got your 50% there, which is absolutely fantastic, because if you can get the baby to feed on one side, we can work on the other, but usually we can get that sorted.
It's normally just that you're a millimetre out.
Yeah.
And just look at, maybe get someone to film you on both sides and see what's different.
And often it's because our breasts aren't identical either. No one has some totally symmetrical breasts. So when you're thinking about how you're bringing your baby on, you need to bring your baby on often in a different way on one side versus the other, because they are slightly different. Sometimes they'll point down more on one side or out more on one side. So you need to think about, how do I bring my baby on this side? Look at what's working on the side that's that's going well, and see if you can replicate it on the other. Good luck with that anyway. Claire's come on. We haven't heard from Claire in ages. Hello both. Very nice to see you reunited. We're quite pleased too, actually. I have a quick question. Baby Sebastian's now enormous, 9.4 kg. He is. I'm 5 months old. Still exclusively breastfed. Well done you. Suddenly I've started getting pain and vasospasm again. Do I just need to move him back a bit more? Is it because he's teething?
They're very interested at this age. They start pulling on and off, don't they, and looking around. They do a bit of rubbernecking, and they suddenly realise that there's a world outside of mummy, and they hear every noise. They move, don't they? Remove distractions. So maybe turn the telly off. Go from a room where there's lots of noise. Maybe go for a darker room for a bit. Sometimes that just concentrates on the positioning and attachment, and that might just support it. Does he feed better at night than in the day? Is it more comfortable at night when he's less frantic and looking around? And it might be just that, and that his mouth's changing shape, and he's teething. He's going to be using you to rub his gums nicely.
You say you only feed in the upright position, the position he hated when he was a newborn. Isn't it funny how they change? They really change.
You can try a different position and just see if that helps.
But always address that positioning attachment. Remember, he's bigger. Allow for him the fact that he's bigger. Remember, even when they're bigger, you still want to start nose opposite nipple, so that their head then goes back, their upper lip to nipple. Even then, you still have to do it. So, but how fabulous that you've grown such a great baby. 9.4 kgs. That's wonderful.
You're doing something right.
Claire, well done you.
Amazing.
That's lovely.
Amazing.
Right, we need to shoot down because there's 9 more corporate messages. Hopefully there are lots of thank yous. Pasqualina's come back and said, thank you. Laurie Betts has said, no risks. Thank you so much for your answers. Great. So just have a go, Laurie Betts. Don't have to do it. Verity, you don't have to do it. Lucy's come back and said, thank you. Claire has said, yes, he is terrible in the day and great all night. Typical.
Take him into a quiet dark room. see if that's what it is. He's distracted.
Yeah.
They rubberneck at 5 months. They're dreadfully nosy, and the world is a place to play, and everything is new, and they just pull on and off all the time.
It settles after that, though,
Yeah,
doesn't
they
it?
go
They get
about 6
better
months, they
again.
get
It's
better.
they suddenly get this really curious phase, and they've got their
And then they
mouth
know
and
what
their
the noises
breast,
are.
and
Yeah.
they're like pulling, and you're like,
Yeah.
leave me
So
behind.
take him out of distraction. You know, take him away from the television or lots of people around, and go into a darker room and try and feed him in a quiet, so that he doesn't have so much distraction. It might help.
Well, I don't think we've got any more. I haven't seen any
Perfect
more come
timing.
up.
We're over time.
Yeah, that's
We've had
fabulous.
lots and lots of questions today.
Thank
It's
you very
really
much
lovely.
to one and all.
And we love your feedback. Keeps us going.
So, Tammy, please get us in touch. Please give us a call. We'll have a chat. Numbers on the website, OUH website. And for all others, you know, use OBS and Abingdon Baby Cafe and La Leche League. And then they offer certainly La Leche are offering, you know, that's a mother-to-mother support as well. It's not just the breastfeeding support, but they are offering that social support, which I think you all need. You all need. I saw something on Facebook this week that she had a lovely medal. I think it was Emma Pickett, who if you're interested in feeding, does some fabulous Facebook posts, Instagram posts as well. And she said this is a medal to all the mothers who've had their babies during lockdown. So well done to all of you, because it's been a really hard time, really challenging. But anyway, we'll see you next week. Thank you very much for listening, and see you then. Bye.
Write your questions.
Yeah.